Good morning, and thank you for joining us today for our free webinar, Tips and Tricks for Telemedicine Insurance Billing in Florida, featuring Sarit Hirschkorn. My name is Jeff Bloom, Education Marketing Manager here at LASA OMS. With the current state of the acupuncture profession, the nation, and the world, we have decided to add to our webinar offerings to bring in experts in telemedicine, practice management, and insurance billing, in addition to our traditional clinical skills-based webinars. Our guest speaker today has graciously agreed to our sessions each day for specific states so we can focus the content and share the most relevant with you. I would just like to go through a few housekeeping items. We do recommend viewing the webinar in Chrome, Firefox, or Safari, as you may experience slowness in other browsers. If you're having any issues with either sound or video, we always recommend refreshing the page, and if that does not solve the issue, we would suggest trying a different browser. And everyone who registered for this event will receive a link 5 minutes after we conclude to watch the webinar on demand. And lastly, we will be holding questions till the end. If you have a question for our guest speaker, please make sure to use the questions tab to assure that we see it at the end. To communicate with other attendees or technical difficulties, please use the chat tab. Now for our featured speaker. We are proud to introduce Sarit Hirschkorn. Sarit is co-founder and co-owner of AllAcuServices, LLC, a company specializing in insurance billing services for acupuncturists, massage therapists, naturopathic doctors, chiropractors, physical therapists, and social workers. After spending nearly 2 decades working in corporate benefits outsourcing for multi-million-dollar companies such as PricewaterhouseCoopers, ACS, and Mellon Bank, Sarit now applies her deep knowledge and understanding of the insurance industry to the field of insurance billing for holistic healthcare providers. Please join me in welcoming Sarit.
Thank you, Jeffrey. Good afternoon, everyone. I want to introduce myself, and then I want to take the time to focus about telemedicine. As Jeffrey said, I am Sarit Hirschkorn. I am the owner and co-founder of AllAcuServices, along with my partner, Robert Venna, who is a licensed acupuncturist in the state of New York and state of New Jersey. I'll take the time today to talk a little bit about terminology so we understand what telehealth means versus telemedicine. And then I want to take the time to explain how we can bill as an acupuncturist for telemedicine, how often we can bill for it. We'll talk about the actual billing codes or CPT codes that we can use with the different modifiers. And then we'll take a glance at the different insurance companies that are offering telemedicine. We'll talk a little bit about consent and HIPAA at the end. So why don't we get started? And we'll start with some terminology. So I want to explain what telehealth means. Telehealth is the use of electronic information and communication by a provider to deliver their services to their patients. These services could be assessment of a diagnosis, a consultation, maybe a treatment, even educating your patients, care management, and self-management of the patient. And that's the overall telehealth. Under telehealth, we have one of the avenues, which is telemedicine. Telemedicine is the actual use of electronics such as emails, texts, faxes, phones, and live stream video. So that falls under telemedicine. I want to talk about how often we can use telemedicine and what is it considered as. So telemedicine has to be a patient-initiated procedure. How do we have the patient initiate it? We can definitely reach out to our patients, especially nowadays with all of us being closed or semi-closed, and just check on our patients. You can send them an email. And if the patient reaches out to you, that is patient-initiated service. It is considered an evaluation, or what some of you may consider it as an E&M code. You will be providing the same standard of care that you would have provided if the patient was sitting in front of you in the office. So if I have Jeffrey in the office and we're going through evaluation that it would perform in the office. It will be the same type of questions that you will be providing either via a phone or a live stream video. The law says that it has to be already an existing patient that is under your care for either acute or chronic pain. And if you are using phone services to talk to your patient and it leads you to see the patient within the 24 hours, you cannot bill for telemedicine, but you have to bill for your acupuncture session. With that said, that's the law. And what you'll see is that insurance companies are being very forthcoming, really trying to be there for their patients. And some of these laws, they're adding to them, allowing a lot more services. So we'll get to that when we talk about different insurance companies. What I want to do is I actually want to look at what the state of Florida, and our focus is today is Florida, what the state of Florida put in terms of law for telemedicine. And we have to keep in mind that when they put that out, they put it out specifically for Medicaid. Okay, insurance companies can take that law and add to it, adopt it, and add more to it. So we are seeing that the state of Florida is allowing telehealth and telemedicine, whether it's synchronous, meaning live stream video where you hear the patient or the patient hears you, or asynchronous. And we're seeing MDs are using telehealth to send out test results and maybe x-rays, etc. They are allowing the use of video. You have to make sure that you're using consent with your patient. So before you have that patient on the live stream video, you need to make sure that you have a consent from the patient to have that session, okay? The health plan can exclude the coverage if the provider is not allowed to give current coverages today, meaning that if Jeffrey doesn't have acupuncture benefits under his plan, the plan is allowed to exclude me as an acupuncturist to provide Jeffrey with telemedicine, okay? On a same token, if the plan, okay, is self-funded plan, they don't have to allow telemedicine, as they can come up with their own rules and regulations as to what they offer and what they don't offer. Okay, what can we offer under telemedicine? So we're very used to being hands-on in the office, having the patient right there, speak to the patients, to do the evaluation in the office. And then when we're done with the evaluation, have the patient lie on a table and start needling, or maybe start providing some modalities. Well, because we're not in the office, what we're going to do is strictly an evaluation, right? So we can talk about with the patient about current condition. If there is other condition that the patient wants to discuss, by all means, let them bring it up. You can do a tongue diagnosis. Anything related to stress, i.e. you can do Qigong exercises, or you can show your patient a couple of exercises that they can do on their own, right? And demonstrate it on the live stream video as to how to do this. So Qi, yoga, Qigong, all of that can be shown to the patient. Even some sort of meditation, i.e. do it with the patient on the phone or on a live stream video, or give them some guidance as to how they can do it yourself. A discussion about nutrition, anything with regard to boosting your immune system, how to eat healthy while home. It's, for me, I know it's hard to control my eating habits. So any nutrition tips would be really helpful. Self-acupressure. So if you want to show your patient as to how to have some trigger points that they can press themselves or treat themselves, they can do that. If the patient is suffering from any pain, where you can show them how to use hot or cold packs, that's something else that you can offer them. Sending your patient herbs, they need to be cooked, or herbs that don't need to be cooked, but just telling them how to take those herbs, something else that you can do with them. And then last is, but not least, is the use of ear seeds. I have a lot of clients, so we're a billing company, and we have a lot of clients that shared with us that they have sent their patient ear seeds, They are charging their patients for their ear seeds, and then they're spending the time with the patient to put the ear seeds together or show them where to place the ear seed on the ear. So that's something else that can be done with the patient on the live stream video. You'll see that telemedicine is measured by amount of minutes that you spend with your patient, and that takes into account the time that you spent in reviewing the notes with prior to the patient meeting with the patient, and then documenting the notes after you met with the patient. So I want to take an example. If I had a session with Jeffrey today at 1 o'clock, and 5 minutes prior to my session, I took Jeffrey's file and I reviewed all his notes. I spent 10 minutes with Jeffrey on a live stream video talking to Jeffrey. And then thereafter, I took 5 minutes and I documented everything that I discussed with Jeffrey in today's session. Altogether, I spent 20 minutes. It was 5 minutes before, 10 minutes with Jeffrey, 5 minutes after to document my session. That all goes towards the minute that I count towards my telemedicine. I'll take a look at the minutes at the next slide so we can see what we're actually talking about here. So we're separating two different sets of codes. One is a live stream video, and you can see the codes are listed, and we'll discuss them in a second. And then we're seeing phone conversation with the patients in another set of codes. We're looking at 3 different categories. So we're looking at category of 5 to 10 minutes, 11 to 20 minutes, and then 21 to 30 minutes. It's still one of these codes. It's not all 3. So if I spent 5 minutes with Jeffrey and then I spent another 11 minutes, I'm not going to charge for 2 codes. I'm going to charge only for 1 code that falls into the range of that 16 minutes, which is the second code of 99422. Okay. These codes, when you put them on the claim, you will use them with a place of service of 02. 02 indicates telemedicine. So instead of putting an office visit, we usually put 11. We're going to put 0. And then we're going to put a modifier of 95, which also indicates the insurance company telemedicine. Okay. I want to talk about pricing. And I'm not going to tell you what to charge, but I want to talk about a formula that you can figure out what specifically you should charge the insurance company. So we look at what you charge for the first set of needling. So for the first set of needling, let's say I charge $100, and I'm trying to make the number super simple, right? So if I charge for the first set of needling $100, code 99421, and I'm going to round it down in this case, right? I like rounding things up. Is worth about 40% of what you would charge for the first set of needling. So I would charge about $40 for the 99421. For 99422, I would charge about 80%. So it would be $80. And then for code 99423, it's actually worth more than 1 set of needling. So I would charge about $120. You can see that the phone evaluations is very similar in terms of the percentage. So I would stick to the same prices for whether I did a phone conversation or a video conferencing. With things that insurance companies are paying between $50 to $70 for these sessions. And the numbers varies depending on where you're located and the state that you are in. With that said, when you are done your session, I can't stress enough, be sure to document your session. If you're using today hard copies, continue using hard copy. If you're using electronic copies, sure that it's documented in electronic copies, everything that you discussed with your patient, the diagnosis that you discussed, and then what suggestion you gave to your patient during that session. Okay. Let's look at the different insurance companies, and then I'll talk about some diagnosis codes and what diagnosis codes we should be using. So this is just high-level insurance companies that we have looked at. If there are any specific ones that we already called in, I'll be happy to answer that during the questions time that we have. But high level, we're seeing that most insurance companies are allowing some sort of telemedicine. If you are part of American Specialty Health, They are the insurance company that we're currently seeing them not offer telemedicine. The reason that they're not offering telemedicine is because American Specialty Health usually administers insurance plans for other insurance companies such as Cigna, Blue Cross Blue Shield, depending on the state. In Florida, I don't think they administer for anyone except for themselves. And because they didn't get the guidelines from these specific insurance companies, they're not allowing telemedicine right now for not for video conferencing and not for phone. Companies such as Aetna have started to offer telemedicine for as of the beginning of March. And right now they're saying that they will allow it until the beginning of June. I think they published as of June 4th. Cigna also allowed it as of the beginning of March. They don't have an end date, and Cigna requested that we keep on checking their website for an end date because they want to see how we're moving forward with this pandemic, when the country will be opened up, etc. So they didn't publish a date. Florida Blue, which is Blue Cross, is allowing telemedicine. They are telling us that they're allowing telemedicine when it's done via a phone conversation. We are seeing that some of these insurance companies are waiving copays and coinsurance and deductibles, but all of this is dependent on the patient's plan. So again, you need to, if you have a patient who is interested in telemedicine, the first thing I would do is I would call the insurance company, find out if they are covering telemedicine. Not only are they covering telemedicine, but are you covering telemedicine by a licensed acupuncturist? If so, are you waiving the deductibles? Are you waiving the copays? Do we need an authorization to treat the patient via telemedicine? Take the rep's name that you spoke to, okay? Take a call reference number and write yourself the date and time that you spoke to that rep. In the event that you do bill for telemedicine and you were told it's covered, however, they end up not paying for it, you can always go back to the insurance company and have them pull up the call with the call reference number that you have written down when you spoke to that rep. I want to focus on Cigna for 1 second, because Cigna initially started with, yes, you should use telemedicine codes. However, their systems seem to be overwhelmed and unable to always adopt the telemedicine codes. They published on their sites that acupuncturists or providers, it'll be easier if we use the regular E&M codes, i.e. anything that starts with 99211, all the way to 99215. So the regular E&M codes with an office visit of 11. So the place of the location should be 11 and a modifier of GQ. So that's one thing that Cigna did ask that providers will do. We are seeing it more and more by the different insurance companies, those companies such as workers' comp. So yes, we called on workers' comp for a couple of our patients. They also requested that we use the regular E&M codes as opposed to the telemedicine codes. Not only that, Cigna, and I don't know if you remember in the beginning when I said that the law says that it has to be for existing patients. However, we're seeing more and more insurance companies want to alleviate the number of patients that are ending up in that urgent care clinics or in the ER. And they are allowing new patients to treat it via telemedicine. So right now we're seeing that for Cigna and Aetna. But if I would call the insurance company, if you do have a new patient that comes and contacts you and they would to have a session with you, I would call and verify their coverage, and I would ask if the new patient is allowed to have telemedicine services, being that they are a new patient. Jeffrey, what I would like to do is I would like to bring up the claim so we can show everyone how to submit a claim. So on the claim right now, what we are seeing is the start date and the end date of our services. You can see in column B where it says place of services, it says 02. In column D, you'll put the CPT codes. If it's Cigna, you'll put your regular E&M codes. But if it's not Cigna, you can put the telemedicine codes with a modifier of 95. Telemedicine can be billed only once every 7 days, and the time is cumulative. So if I speak to Jeffrey today for 10 minutes and tomorrow for another 10 minutes, I bill for it once with the total time that I spent with Jeffrey. Unless, and I want to go back to my presentation for a second. So Jeffrey, if we can bring it back up, thank you. Unless Jeffrey was presented to me with a new diagnosis. So these codes can be only billed once every 7 days. If today Jeffrey complained about migraine and I spoke to Jeffrey for 21 minutes, I will bill for 99423. Jeffrey reaches out to me tomorrow and he's suffering from severe back pains. I can bill for it again because Jeffrey presented themselves with a new diagnosis. With that said, I would like to go and talk about HIPAA and consent. So all of you need to make sure that you have a consent out there from a patient. I know, Jeffrey, you have posted yesterday on one of our sessions a consent that another provider shared with us, and we'll be happy to share it with you again. Again, keep in mind, it's not something that we have reviewed, not myself or Jeffrey. We're not an attorney, but it's just something that was shared with us, and we're happy to share it with you. Take it with a grain of salt. Make sure that you are reviewing it. Make sure that it includes things such as, hey, if my patient's data was compromised, I'm not liable for it, because one of the things that we want to make sure is that the patient's data is not compromised. We do suggest that you use a HIPAA compliant system just to protect yourself from data being compromised. The links that we're putting out there are, or out here on that presentation, are just some of the systems that we saw of that are HIPAA compliant and have some sort of a free either sessions for a free month or have a limitation on the number of people that you treat, right? So if you're seeing 5 patients a month, it'll be for free. But if you're seeing over 5 patients, they'll start charging you. So these are some suggestions. If you're using an EHR program that already has telemedicine in it, by all means, go ahead and use it. The HIPAA rules are always out there, and you must make sure that you exercise them. However, insurance companies are telling us that they're not enforcing the HIPAA penalties because of COVID-19. But continue using HIPAA compliant systems to protect your patient's data. Jeffrey, I am gonna pass this back to you. We can open it up to questions, and I'll be happy to answer questions as we go.
Well, thank you very much. It looks like we do have a few. Looks like we do have a few questions here, so let's get started. Let's see. Is it true that telemedicine is not covered in Florida for acupuncturists?
We have not seen that. We know that both Cigna, Aetna has been paying for telemedicine. So it depends on your patient's insurance. You need to make sure that you cover, you call the insurance and you let them know that you're located in Florida and you want to know if they will be covering, specifically when it's provided by a licensed acupuncturist. I can't tell you enough that you need to stress that you're a licensed acupuncturist and not an MD. So the rep gives you the correct information.
Alrighty, and then next question regarding Tri-West billing. The VA is allowing telemedicine, so do we need to request?
So the VA is allowing telemedicine. If you do have an approval, so let's talk a little bit about VAs. VAs usually, they give you authorization. You get a packet with a start date and an end date of when you can start seeing that patient. Not only they provide you with a start date and an end date, they give you the number of sessions that I can see Jeffrey, okay? That session that you're having with Jeffrey via telemedicine take away from the visit limit that you have with that particular patient. Okay. You also can treat Jeffrey only for the diagnosis the VA told you. If Jeffrey is coming to you with anxiety, however, the packet told you back pain, guess what you can treat? Back pain, not anxiety. Right? That's what he was authorized for. Now, if Jeffrey would like to be treated for anxiety, Jeffrey needs to go back to the VA and request a packet that authorizes you as an acupuncturist to treat him for anxiety. Okay, you want to make sure that you cover all your bases, because the authorization that you have tells you which diagnosis to treat for and the number of sessions that you have. And so if you're treating for something else, you're not covered. And that's true for all insurance companies.
All right. And then somebody would actually like us to clarify the use of 02 for live video and then 95 as the modifier.
Okay, so I can only speak to how being used. We're seeing that different insurance companies may tell us to just use regular E&M codes, but 02 basically indicates 02 for a location is a new code that was added for telemedicine. Okay, it indicates to the insurance company that the patient wasn't seen face-to-face. I'm sorry, it wasn't seen within an office setting, but was seen face-to-face telemedicine. The same thing with the modifier of 95. It's basically indicating to the insurance company that you're using telemedicine code, synchronous live video with that patient. It can also be used for a phone conversation with the patient.
All right. Well, Janet,
and if that is not true for Cigna, however, right? Cigna wants you to use in a place of location. They wanted to use 11 in the place of location, the regular 99213, and then GQ as a modifier. And it's published on the Cigna site. You'll be surprised, these rules change on a daily basis. The best thing to do is call the insurance company and also go on their site, because they update these sites on a daily basis with the dates that they will end telemedicine, the date that the codes that they would like you to use. But if you're unclear, either ask your billing company if they're doing it too, or if you're doing your billing yourself, call the insurance company and find out.
Alrighty. Next question was, I was informed state employees now have coverage. When I first asked, the insurance company said it wasn't covered, but what if they received a letter saying that they are covered, meaning the patient?
Okay, so what I would do is you have to remember that the reps are new to this also. And while you may get one answer from Jeffrey today, the supervisor may give you a totally different information, because they're trying to educate those reps as fast as they can. Call the insurance company again, let them know that your patient has a letter, and you can give them a copy of the letter if they ask, or give them a copy of the letter or email them. Also, I would have my patient call, because the people that you have answering the calls for your patients are totally different service center, the ones they have from the provider. Most of these service centers that you have that are answering the questions for the patient are actually onshore, and they're more familiar with the questions and the answers that they should be giving their patients. So if you're not getting the answer that you think you should be getting, have your patient call, or you can call with your patient on the line, asking the correct questions directly to the patient services as opposed to provider lines.
All right. I think you kind of clarified the next question during one of your last answers, but somebody wanted to confirm with Cigna, do you also use modifier 95?
No, GQ.
GQ. And that one, the service place is 11, not
Correct.
02.
Correct.
Okay. Perfect. And then Janet, if that didn't answer your question, please throw another question in to clarify more. Next question's from Jennifer. Hi, Jennifer. Does the 7-day limit include other providers as well? So if a patient had a telehealth session call with another provider yesterday, could I offer my telehealth services today?
So no, it only includes you for your NPI. Okay, so we don't care about other providers. We care about what you provided. It's a relationship between you and the patient. If somebody else gave them services, great for them. But you need to focus on what you have provided that patient for those 7 days. They look at the NPI, the rendering NPI that provided these services. So you and you only.
Okay. We have a question about consent. So they said, what type of consent form is used, and can the consent be verbal?
No. Verbal consent is not good enough. And when I was a kid, my dad gave me a really, really good advice. If it's not written, it doesn't exist. So God forbid the data gets compromised and then you have he said, she said. We want to make sure it's in writing. You know, I'm not an attorney. I don't want to give you legal advice. That's just my personal advice. I would say have it in writing. Have a consent that is in writing, have a consent. Today, when a patient walks into my office, into anybody's office, they sign that they're familiar with the HIPAA regulations, that they know that the data is not being compromised. It needs to be similar consent when you're performing these types of services.
Perfect. And then, so I did share in the chats a link to view a telehealth consent form online. This was shared in a different webinar the other day, and just like Sarit had said, neither of us have gone through it or audited it, but it was shared by an acupuncturist the other day. So feel free to take a look at it, and if it works for you, feel free to use it. And then next question would be Zoom claims HIPAA compliance. True or not?
False. So Zoom is not HIPAA compliant. However, if you look at what Cigna published on their site, and I don't know if we can make this any bigger, but and I'm trying to look for these lines on where Cigna published it. Actually, Cigna published on their website that you can use FaceTime, WhatsApp, Zoom, Google Chat, whatever works with your patient. They are not enforcing, and it's actually right there in the second paragraph or the third paragraph. They're not enforcing the HIPAA rules. So during COVID-19, you can use Zoom. However, it's not HIPAA compliant. Zoom for Business is HIPAA compliant. Regular Zoom is not.
And Zoom for Business is about $200 a month. And there are free services out there that are also HIPAA compliant and will not cost $200 a month. So I'm not saying you shouldn't use Zoom, but there are options that are much, much less expensive out there. Next question is, what about workers' comp? Is that covered?
So it depends on a workers' comp plan. Again, call the adjuster, find out. We are seeing that some of the workers' comps do cover telemedicine, but call the adjuster and find out if these services are covered. I would never assume, and I would want to hear it from somebody's mouth that my patient is covered for these services, because I want to ensure that I will get paid.
Alrighty, another good question here. So there are different definitions of telehealth, telemedicine, virtual visits, etc. Which are you billing for, and are there differences in billing?
So I don't know about different services. They're all the same, right? So telemedicine uses, as I said, 5 things, right? That's why I want to make sure that we're clear on the terminology. Telemedicine is the use of live stream video, phone, emails, text, and a fax machine. That's it. That's what falls under telemedicine, okay? Different insurance companies cover different one of these particular options. So if I go back, right, we're looking at 2 different sets of codes. We either look at phones or the use of a live stream video. When you call the service center and you ask, is telemedicine covered? Don't assume that the rep knows what you're talking about. If you're planning to use a live stream video, when I see Jeffrey and Jeffrey sees me and Jeffrey can hear me and I can hear Jeffrey, I would use the codes of 99421, 422, 423, okay? The other codes is via a phone, and that's the 441, 442, and 443. I would actually give those codes to this rep and ask them, can a licensed acupuncturist perform? And you only need to give them one of each codes, is 99423 and 99443. Is the patient eligible for these benefits? So those are the only codes that you have that you can use for telemedicine. But we are seeing, right, that some of the insurance companies are telling us to use the regular evaluation codes, even though you perform telemedicine with your patients.
Alrighty, moving along. Next patient or next question. If a patient has a dual plan with Medicare and Blue Cross Blue Shield, will telehealth be denied as we are not Medicare providers? The plan was covering acupuncture here in Florida.
Okay. So, and I'm sorry if there's noise in the background. I guess somebody decided to do my grass. Sorry. So Medicare does not cover acupuncture at all. They don't even view acupuncturist as a provider. However, any secondary plan that the patient may have may cover acupuncture. That is the same question that you need to call and find out from the insurance company. So you need to let the insurance company know, I'm a licensed acupuncturist. Does the patient has coverage for telemedicine when provided by a licensed acupuncturist? If the answer is yes, that's all you need. We don't need to get a denial from Medicare. You just need to know if the patient has that services under the secondary plan.
Okay. So actually, we're going to go back to the question originally about the Tri-West and the VA. So
Okay.
it looks like I may not have asked it very well. So
Okay.
I'm asking if we need to request telemedicine codes on the original authorization or E&M codes on the authorization. She wants to clarify what to ask the VA to authorize it.
Okay, so we are seeing that the VA told us to use the regular E&M codes. If you don't have those E&M codes listed in your packet, and usually they list, like, I think like they list everything, all the modalities, the acupuncture, the E&M codes. Sometimes they're careless and they don't put E&M codes on there. I would call them and let them know. And I would also ask the patient to call that we are seeing the patient via telemedicine and we're having these services and we're not seeing not the telemedicine codes on our packet or the evaluation. Can they amend the packet?
Okay. Well, I hope that answers your question, Melissa. And if it did not, please feel free to put another question in. And I apologize for misreading it the first time. Next question is from Jerry. Are you familiar if telemedicine coverage will be available after the crisis ends?
So right now, we are given end dates by most insurance companies. Do I see that as the way of the future? Absolutely, right? With this whole pandemic will change a lot of things in our country. And I think that this probably will change as well going forward. It's definitely something that we need to advocate for and make sure that we're included as acupuncturists with the insurance companies. But I can't predict the future right now. We are seeing an end date to telemedicine.
Okay. And then somebody did ask for a copy of the slides. So we're not sharing the slides. However, you're more than welcome to take a screenshot if there's something that you'd like for the information. The reason we're not sharing the slides is because this information is changing almost daily. And she's doing research the day before these events to make sure that everything's as up to date as possible. But tomorrow, everything could change and there could be different information. So for that reason, we're not sharing the slides, but please feel free to take screenshots and use this for a point of reference. But just note that, this is the current information today, tomorrow may be different. Next question was from a recent webinar. With Florida, acupuncture physicians can conduct telemedicine with a new patient for initial visit. What are the CPT codes for initial online and phone visits?
So it's the same CPT codes. So if insurance company telling you to use E&M codes, right, the regular evaluation codes, you would use the same E&M codes that you use for new patients, the 99203, 214, 205, 212. But if you're conducting telemedicine, they don't differentiate between new or existing, because you have to keep in mind that this was created when only existing patients were allowed to be treated by telemedicine. And so we're using the same codes.
Okay. Next question is, are there 994 blank blank codes visits for longer than 30 minutes?
No. And even if whether you spend 60 minutes with Jack on the phone or 20, you're getting paid the same. So it's 21 minutes and over. It's the same code.
All righty. And I don't know if this is in the scope of this webinar, but if I do have a televisit with a Cigna person and they waive copay and deductible, if I were to determine that they need an acupuncture visit in person, would the copay and deductible still be waived?
It really depends on the patient's plan, because they waive copay and deductible for telemedicine. And if the patient is having an acupuncture visit, you need to verify if copay and deductibles are actually waived for that particular benefit, right? So they're not saying, hey, we're waiving all copays and all deductibles for all benefits, right? It's per benefit. So find out if for acupuncture it's waived.
Alrighty. Well, looks like that would be the last question, unless anyone gets one in very quickly before we finish. I want to thank you for your time, as always. This is our 7th or 8th state, I think, at this point. So Sarit and I are becoming very good friends. We see each other pretty much every day at noon, and we'll be continuing this for the next week or so. So I want to thank everyone for taking out some time in their afternoon to learn a little bit about insurance billing. Sarit's company is called AllAcuServices LLC. I'm going to throw a link in the chat. So if you have specific questions for Sarit or about her services, please reach out to them. Thank you for everyone for taking time out today. Thank you, Sarit, as well for your time. I will see you tomorrow for Massachusetts.
Yes.
Tomorrow, we will be hosting Michelle Gellis at 7:30 p.m. Eastern Time to talk about changing the face of our practice and adding some cosmetic treatments into your telehealth visits. So please check out the LASA OMS blog for registration details, and we look forward to seeing you all soon.
Thank you, everyone.
All right, have a great day, everyone.